My name is Amaya Tavares, and I'm going to be demonstrating a ministering piggyback medication. So, the first thing that you need to do is check the medical order within the MAR. You need to check for the patient's name, the medication, the dose, the time, the date of the order, allergies, and the route. And then after that, you need to check for the compatibility, and you can check that 3 ways. You can check that with the compatibility chart, a reputable internet source, or you can call the pharmacy. After that, I'm going to gather my supplies. I'm going to gather my correct medication, and that is Ancef 1 gram, intravenously piggyback every 4 hours, infuse over 1 hour, and this is 125 milliliters. Then I have my secondary medication tubing, and this has a drop factor of 10. And also my antiseptic swab. So after I gather my my equipment, I need to then calculate my drops per minute. So my piece of paper, it is blank. So I have, we're just not going to look at that. I have 125 milliliters. So what I'm going to do is 125 milliliters times my drop factor, which is 10. And this says infuse over 1 hour. So we're going to do 60 minutes. All right. So what you're going to do is 125 times 10, and that is 1,250. You're going to divide that by 60. You get 20.83333. Okay, repeating 3. And so what you're going to do is you're going to round that to 21. So now I have calculated my correct infusion rate for my medication, and that is 21 drops per minute. So now,
let me see the paper.
Oh. Okay, so now what I'm going to do, now I'm going to open up my secondary medication tubing. Now, whenever you open this up, you need to try to maintain sterility with these ports. So here is my my hanger for my tubing and my medication. So let's get this out. Okay, I'm gonna kind of just wrap it around my hand, making sure just to not touch that top part. And I'm gonna take this out just like this. So I'm going to have it like this. Now what I'm going to do is I'm going to make sure I close my regulator clamp all the way down. Now what I have to do is I'm going to get my medication. Try not to touch that. And I'm going to spike it. And by doing this, I'm just going to take this top off. All right, make sure not to touch that top. So I'm going to hold it down here. I'm going to get this. I'm going to take this off. I'm going to spike my tubing. I'm going to twist it all the way in there to the rim. Okay. Now what I'm going to do, I'm going to flip it upwards. Now what I have to do is I'm going to have to prime my tubing. So what I'm going to do is I'm going to go over here and I'm going to hang this up right here. And I'm going to prime my tubing. Okay. Now, when you go to do this, also, I forgot to mention one thing. When I went to spike it, I hold this and I fill it up halfway. I fill it up halfway in the chamber. So I'm going to just hold it and I'm going to fill it up halfway. Halfway. Okay? Now, when I go to prime it, I'm going to do it very slowly. I'm getting basically all of the air bubbles out. But I'm going to do it to where, very slowly, to where not a lot of my medication is wasted. Okay? You see the air bubble is coming down. Alright, it's passing through here. Now, I just got it out. Then, now, I close my regulator clamp all the way back. Now, what I'm going to do, I'm going to now take my medication and I am going to also take my hanger and my medication swab, my antiseptic swab to my patient's room. Now, when I go to my patient's room, I'm going to identify them in 3 ways. I'm going to ask them their name, date of birth. I'm going to check their wristband. I'm going to introduce myself, and I'm going to explain the procedure, and I'm also going to verify allergies. So, after I do that, I'm going to perform hand hygiene. After I perform hand hygiene, I'm then going to hang my medication back up. Okay, gonna hang my medication back up. Okay, now what I'm gonna do is I'm going to then get my primary tubing and I'm going to lower it to where it is lower than my medication. All right, see, so I lowered it now. Okay, now what I'm gonna do is I'm going to get my alcohol prep pad and I'm going to come over here and you have to maintain sterility of this port. You do not want it to get contaminated at all. So I'm gonna clean the port for 30 seconds and make sure that it is clean. After I clean the port for 30 seconds, I'm gonna get this. You have to be very careful to maintain sterility. So do not touch it, do not get close to that port. I'm just doing it on the tip. I'm gonna set that there. I'm gonna get this port of my primary tubing and you have to maintain sterility. What you have to do is, you have to push it in there and twist it. Just push it in there and twist it to where it's on there all the way. All right. Now, once I put it in there and I put that up, everything is done now. Well, I have to basically do my drops per minute. I have to set the infusion rate. So what I'm going to do is I'm just going to sit here and I'm going to do my drops per minute for 21 like we calculated from the medication. So I'm going to sit here and I'm going to just do my set it for 21 drops per minute. Now, whenever I finished setting my rate and everything, I'm done doing that. So let's say that I want to go and discontinue this. So what I'm going to do is I'm going to make sure that this is closed all the way down. My regulator clamp on my medication is closed all the way down. All right. I'm going to get this. I'm going to untwist it. All right. I'm going to get my medication. Also, this, I have to hang this back up into the higher position. All right. Now, whenever you do that, you hang it up to the high position, you have to set the flow rate on your primary tubing back to what it was originally ordered. So after you do that and you set it back to what it was normally was, you then discard of your medication and everything else per facility policy. Then after I do that, I will wash my hands, perform hand hygiene, and I'm going to document. And what I'm going to document is the time of administration. I'm going to put my initials in the appropriate box, and I'm going to sign my signature on the bottom of the MAR. And that is everything to administering a piggyback medication.